And there's a secondary.
This meeting is being recorded.
There's a secondary committee who the caseworker has to present to, and that looks different across the state, right? But essentially, they have to present all of the efforts they have made, and the committee, first of all, reviews the entire case and may make recommendations that haven't been explored. And if that happens, those actions must be explored and they come back to the committee. Everything is documented in writing, and the committee will only sign off when they feel that all efforts have been exhausted. Generally, that committee is going to be looking within 24 to 48 hours of that removal to try to pursue, kin as close as possible.
Awesome. So I'm curious if you could talk a little bit about, because I imagine a lot of the audience for this video, whether you're here live or maybe you're watching it in the future, is going to be, okay, I want to implement this firewall policy in my jurisdiction. So when did you first start, and Natalia, I'll start with you. When did you first implement this, and what was implementing like? Did you have to do training? Was there a policy dissemination? Like, could you talk a little bit about what that looked like?
Sure. So 2012, in 2012, we had the Annie E. Casey team come out and do a kinship process map. Did a kinship process map for us because we were starting to think about, kinship as a resource for children who enter care because it's the right thing to do. So that started, it was a statewide review, came out with some recommendations. Region 4, which is one of our higher, the volume of families and cases and where we're located, implemented it regionally in 2013. Back then, in that time period, each region, we have 6 regions in total that cover the entire state. Each region it was their own mini office, so to speak. So that office director, that regional director, was responsible for the operations of their team. We have since changed. So the firewall was first established in Region 4, and it was our systems program director who was responsible for mental health, kinship, and contracts that said, this is what we're going to do. The key piece is that there was leadership buy-in. The regional director who was over the 2 offices, the program directors, the program supervisor, it was an expectation that was put forth. Everybody was on board, and then everything was structured around meeting that expectation. LexisNexis, bringing Dr. Crumbly out, implementing some of the changes that came out of the process mapping process, taking some chances with that. And then later on, under Commissioner Katz, and I was trying to find the memo, other regions started to adopt a similar process. It's, and again, every region had their own team, etc. Every region started to adopt their own process. And around 2019, with Commissioner Durantes, the structure changed where foster care was now centralized under one director and a child welfare group. And then kinship firewall, consistent practice across the state. And, expectations are set. People will do what they want to do, but the expectation is there. So that answers the question, like how we got there. When did we start? So loosely, it began 2012. It took root in Region 4, 2013, slowly adopted across the state. And then in 2019, our kinship practice just was blossoming along the way. So it just became a no-brainer.
Yeah, that's some significant history, though. That's great. Thank you for sharing. Shelley and Trish, how did New York start implementing? And I imagine you had your own challenges with a county administered state.
Certainly. So our work historically, right, started with, again, Casey Family Programs. So, they're an integral partner for all of us, right? Really, it started in 2009 with some work that we were doing with the disproportionate minority representation piece, right? So when I say that, because our kinship firewall is tied really closely with a process that we refer to as the blind removal process. And when we issued our policy directives in 2020, we issued both of those directives separately, but on the exact same day. And our blind removal process requires that there's a kinship priority placement that happens first, no matter whom that child is, right? So it really started on one element that as we learned and, improved our understanding and development of, the impact of families and how that really impacts outcomes, that it wasn't impacting outcomes equitably across the state. So they kind of morphed and developed hand in hand. So then fast forwarding to about 2018, 2019, we started to require kinship policies. And then as we're developing our blind removal process across the state and holding summits and really diving into the data, we hand in hand, and as Family First is coming now too, right? And understanding that we have to take that family approach first for lots of reasons, we pushed forth in 2020 that all counties had to have a kinship policy that was amended to include their firewall practice. And then in that directive, we talked about pre-implementation steps as well as implementation steps. So the pre-implementation steps really talked about assessing yourself as a county, what's your organizational readiness. Look at all of your policies, where do you have anything that prohibits or creates obstacles for including kin? What are your disparity gaps and how can you make improvements there? And then doing a data collection and analysis both on DMR and your use of kinship resources. And then professional development and, training towards, eliminating biases. And then with the other implementation components, sorry, there's a fly and it's bugging me. I'm not leaving
You're okay.
I'm like, geez. And I don't want it to go in my mouth as I'm talking. That would be like, ooh. So then with the pre-implementation for the kinship firewall, we wanted to make sure that the previous kinship policy that was required in 2018 was amended to include the firewall itself, that every county had to have a written protocol. So you can't just say we have a firewall. We want to know that you have steps and that everybody in your county is trained on what those steps are, and that everybody's firewall must be initiated at the time a removal decision is made and throughout the life of the case. So any opportunity where it is to explore family or kin once again, that happens. And that all of the efforts to engage kin must be documented. That the secondary review, which I talked about, that must happen and it must be documented. And then ongoing efforts are always made to replace kin. And the requirements also included that there was a quality assurance measurement to that. So all cases that went through the firewall had to then be assessed later on, and always looking at through the lens of what could we do better.
Awesome. Lindsay, what was it like implementing in Tennessee?
I do not have the detailed date timelines like these other folks do. I'm super impressed, by the way. But it was well over 10 years ago when we implemented. I was actually in the field when it happened, so I can kind of talk about it from a worker perspective. We obviously had training, a new policy that came out. This is what the expectation is. There was a form that we still fill out, but we filled out at the time. I think one of the things that made it very effective at that point was there was one person for each region, and we have 12 regions, but there was one person for each region who was responsible for approving the kinship exception request. So the expectations were the same. Like the person who's reviewing it was the same, and it was somebody who was in leadership but outside of the line of supervision of the worker. So by the time that it gets to the kinship coordinator, it's already gone through the worker, the team leader, and most of the time the team coordinator, and then it would go to the kinship coordinator to review and then make recommendations. So I think it was helpful to have that person. Now we currently do it a couple of different ways just because it's not feasible all the time to have the kinship coordinator in the middle of the night approve, so in cases like that, the team coordinator, which is like 2 levels of supervision up from the worker, approves it, and then the coordinator looks at it the following day and makes any additional recommendations at that time. But I think having that one person whose job it was to review, approve, really created the same expectations across the region. So there wasn't a lot of difference. One of the things we see in Tennessee, especially since we've implemented additional folks who can approve those, is there's a bit of a difference in standard, and sometimes almost unrealistic. So we've got some folks who probably don't ask enough questions, and some folks who are like, here's the entire friend list from their Facebook, and have you called everybody? Well, everybody your Facebook friends, but it might not be like, somebody we want to be a placement. So I think that having those clear expectations and the person who's responsible for doing that really helps the practice be aligned.
No, I appreciate that. That's a nice lead into my next question, which I'll open to all of you, and anyone can share it. And I hope my dog is currently attacking the vacuum cleaner, so hopefully nobody hears that. What challenges, if any, did you find in implementing, or do you see today in using the policy? And one question I see from chat that I will add to this is, how do you balance the time between, maybe that kid needs placement right now, and we all know kin finding and kin engagement can sometimes take a while, right? So how do you balance that? And I'll let anyone jump in with the answer. Natalia, I see you off mute, so maybe you can go first.
Yeah, I guess we're doing the challenge that we had, I think, was philosophy. The philosophy of actually thinking, yeah, kin can do it. So from internally, our philosophy of, that kin actually is a resource. Fictive kin are resources. They are, it can happen. The other barrier that we had was perception. Not only the family's perception of the Department of the Child Protective Services, child welfare. And you're coming to me to do what? And I have to sign all these forms. Why? And these are all the mandates. Open up your cupboards, very intrusive. So, our relationship with the community was a challenge, because we had to show that, yes, we do want to keep children in the community, right? So that work of trying to improve our public relations, if you will, was a challenge. Both sides, right? Because internally we had people who had perceptions of kin. Another area that was a challenge, and I could remember kind of being in foster care and kind of having lively discourse with our colleagues around why I would support a relative despite their criminal or perhaps their child protective services history. And I say that it's not kinship or bust, right? It's not kinship or bust. Safety, assessment, support, is needed. But I need to acknowledge that there's a racial justice, social equity component to it. Many of our kin providers, a good portion of them are Black and Brown, criminal history, some of, things that they've done, but others that they might not have, or things that were 30 years old and we were still holding them accountable for acts that they did when they were 20, and now they're different. So having that shift, of looking at it through a racial justice lens, which I think was a key component of those two things happening. Our prevention work, our racial justice work, our fatherhood work, and our kinship work all kind of coalesced around the same time and touched. There's a crossover in terms of practice, values, and beliefs. So those are areas. Today, I think the challenge that we're facing, quite honestly, is the resources that are available. The resources that are available to families who need support. We are working now to streamline our kinship standards to remove a lot of those waiver barriers that are there. And to, doing our family first with to build up community. The family search piece, I if I had Nirvana, well, Nirvana would be no child would come into care and we would serve them in their communities and their families. That would be Nirvana, but that's not here. If we had a dedicated team of people that just did family search, that's all they were responsible for doing the family search, going out and doing the interview, doing the background checks, and kind of building the network so that our licensing people can then take it and say, this will be the primary caregiver, and these will be all the people that will support that child. That's something that DC had that we because of Generations United and Casey, they put together a peer-to-peer group, and we were able to see DC's operation. They had retired people who knew how to do the search in the FBI, like they were CSIing it. That's something that I wish we had today, because I think that would speed up a lot of the process. And then just the time it takes, the way that it works now, if we identify a relative, it doesn't matter. I had a worker out till midnight because we wanted to place that child with that relative that night. So if we needed to send you out at 8 o'clock at night to drive an hour to go do a home assessment, that's what we're going to do. So those are some of the philosophy, people's perceptions and their ideas of, their own biases sometimes impacts. And then being able, which I think Connecticut does well now, being able to challenge those assertions up front and say, did you not bring them forward because, CPS has to do the initial assessment, foster care does the second. So CPS might rule out someone that foster care actually might rule in. So that conversation needs to happen, and we need to challenge it. So that's it. That's a lot. I'm sorry, Tennessee.
Oh, no. Lindsay or yeah.
Yeah, no, I'll go. We've had a couple of challenges outside of what I had previously discussed, but one thing about the time, I think that's a really good question. I'll talk about the challenges. One thing about the time, that was the initial challenge, was that staff felt like, gosh, this is going to take so much longer. But honestly, in Tennessee, the way that things work is we do child protective services, and then they're out there and they decide to make a removal. We have a child and family team meeting before we can remove. So usually before you're having those conversations about who can come to the meeting, who do you know, like what are the relatives. So a lot of times, a lot of that work has been done before we even decide, or we even made a decision as a team to remove. So you have the people, right? Like the finding the people part, a lot of times happens before the removal is decided. And then we do a process called full disclosure. And at that point, we have to tell the relative like all of their options, because we have some non-custodial relative options in Tennessee. We have to tell them all of their options so that they can make a decision about what would be best for their family, whether it be a custodial arrangement or a non-custodial arrangement. And make sure that they get that information. I think that that has created a bit of a challenge, only because I think there's a tendency of wanting to really avoid foster care. But sometimes relatives need the additional support, like childcare funding and things like that, especially for littles. So that's a piece of it. One thing we're really lucky to have in Tennessee is we have Isaiah houses. I'm not sure if other states have. I know they're moving into different states as well, but I'm not sure how many have them. But it's a house where kids can go. So if it's taking us a while, if we have to drive to Memphis or something like that to make something happen, or we do have places where kids can hang out, like in home-like settings to pass the time. But honestly, people are just creative. Like if you have to go to a far place and the relative's already there, go ahead and walk me through your house on FaceTime. Let's go ahead and start asking some questions. And so by the time we actually have to get somebody there, we could just take the kid with us and not have to, then go back and do all that stuff. So I think the time thing, you just get creative, like what makes sense. And depending on what your approval process looks like, it certainly could take more time, I would suppose. We've had some challenges with external partners, like attorneys who represent kids or families or parents who have their own bias about kinship. And there's even been some laws that have been created in Tennessee as a result of some of that, like laws that penalize by misdemeanor if a kinship family allows a child to have visits with their parent that was not approved by the court, but it doesn't have the same penalties for foster parents, like a traditional foster parent. And we've been struggling about making sure that people understand, like, hey, by the way, if you are going to be a foster parent, you need to make sure that these rules specifically apply to you. If in a meeting, we have to report every year to the legislature, if in a meeting, anybody on the team doesn't want a child to go to a relative, but the team decides to go to the relative. So we've faced some like anti-kin advocates who will lobby the legislature, who then will create laws that we have to figure out how to implement. So I do say, with Natalia's suggestion about the team of people, that's something I had proposed. I would love to have that here. I had proposed a while ago to do a kinship team that would come in during, like, once CPS decided that we needed to remove a child, that there would be a worker whose responsibility would come in from the non-custodial and then bridge that. So even if we couldn't find anybody, or if we identified somebody from out of state, they would do that at CPC, or they would continue to search until we were able, and we can get relatives the same information too. I think that full disclosure part sometimes doesn't get communicated exactly the same across the state, but those are some of the challenges that we've experienced. I would love to have a kinship team. I just have to find the money.
Oh, no big deal. Yeah. Shelley or Trish, or do you want to share from New York?
Sure. I'll pass this off to Trish with a direct experience lens, because Trish does have direct county experience, but I'll just preface it with, obviously, second and thirding that culture shift change, right? And the idea of sometimes we prevent a placement on items that we wouldn't have removed a child from the home for, but yet we won't place a child in a home if there's an issue. And that, to me, is just so backwards, right? If you wouldn't have removed a child because these issues existed, it's okay to place a child in a home because they do, right? And then sometimes, have to be administratively transparent. Sometimes things happen to check a box and say you did it. And then sometimes you're intrinsically intentional. And so fighting that battle of, how many requirements can you put on a jurisdiction, and then, allowing them to make that decision of what they have to prioritize and what becomes that box check. But Trish, did you want to talk about, from your home county's experience, any challenges that you saw with this?
Sure. Thank you, Shelley. So, I'm new to state government, and spent most of my child welfare career in county government. So I definitely have that lens. And I would say that from the county perspective, administering or shifting to, kin first was definitely a struggle with challenging our biases, right? And calling attention to that. And that's an uncomfortable place to be, but it's necessary. It's necessary to have those difficult conversations, because I think a lot of times the thought process was, well, the apple doesn't fall from far from the tree, right? And if we're at a place where we're removing children, then let's just get them to safety first. Let's get them to a foster home. There's a lot of assumptions that the foster home was the safest place to be. And then we'll explore family. Then, we can take our time with it. We can truly vet a family. We can make sure that all the I's are dotted and all the T's are crossed, and that, because operating from a place of fear, right? Our own fear. We don't want to then, place a child, take a child from an unsafe situation and put them in another unsafe situation, right? So there's a lot of assumptions that family was going to be yet another unsafe place. So working with our staff and helping them and challenging them on that thinking and that logic, and really, I think what helped with that is like, and our leadership was very big about, this is the culture shift, and this is the expectation, and this is what we must do. We must explore family first. We have to make that change. So while we're working on, helping staff with biases and having those difficult conversations, we're also mandating that this is what the law says. This is what we need to be doing. And here's how we can support you in that. And then having those policies in place where we implemented the blind removal process. We also had implemented what we called a triage unit. It was a little bit unique practice in which, because, another fear was like, we don't have the time, right? We don't have the time to do that right then on the spot. If we're having a conference about whether or not we're going to be removing, and then exploring family at the same time. And, there's only so much time in the day. So there was a triage unit that we developed, and their sole purpose, they didn't carry a caseload. Their sole purpose was to do the family finding and work with the families, and that our kin resources, our fictive kin resources, go out and talk to the families, talk about all of their options, explain Article 6, Article 10, kinship, guardianship, like all of the options, and really make sure that the families were understanding what the ask was and what they really could do. And if they couldn't do it, what part of that process could they be? How could they support the kids? Can we have some sort of a safety plan in the meantime until we're able to explore other relatives, and really just driving that passion forward. And that's kind of how we got through some of those struggles.
Great.
Thanks,
you all.
Heidi. Or thanks, Trish. I just wanted to say too, I read Heidi's text in the chat, and yes, every county actually has what is designated as the kinship champion. And so in 2021, we had required all of our counties to designate an individual in the county who received training from the state. And the county, again, has the ability to how they want to utilize that individual in the county, but they are the county resource for both their coworkers and for kin coming through, to be able to walk them through what their choices are legally, what that looks like, the options that they may want to have. And sometimes they are the individual who goes to the family. Sometimes they support the caseworkers who go to the family. And the other component that I think we struggled with, my perception, right, in New York, my story, is that as we built our kin strategies and understandings, we layered them, and they became this layer next to our child welfare work. And I think anybody who's developing or implementing this has to become part of your child welfare work. It's not in addition to, it's not an extra step, it is part of it. So the sooner that is infused, the sooner it gets embraced. And then it becomes, as Trish said, it's not this additional thing, it's part of. this is the second step that we do. It's not, oh, by the way, we have time to do this later. It becomes that next step. And I think that's really integral to having it be successful.
Awesome. Thank you all so much. That was really transparent and really generous of you to share the challenges that you've seen as others hopefully follow in your footsteps. Lindsay, I'm curious, and you maybe don't know yet, but in Tennessee, you've had this kinship firewall for a long time, but you were one of the very first states to do kinship licensing this year. Has that impacted the firewall at all, or made things a little bit easier, maybe, or not yet?
Our staff love it. I definitely think that it makes them probably push for an outside of custody placement less, like if a family really needs it. Of course, families love it. I mean, they don't know any different really, because the newer families don't know that there's another option, but certainly having that be easier is helpful for everybody. I don't know that it's moved the needle as far as, you know, the willingness to approach can. I think that it probably has just changed which path they would go down, because we have a non-custodial relative caregiver program where if a relative has custody of a child, regardless of their financial situation, they can apply for a relative caregiver stipend, and they don't have to remain involved with the department, and we will pay them that stipend until they turn 18 or graduate from high school, or until their custodial situation changes. There's like a contracted person who walks alongside of them just to like check in and make sure that, you know, we're not misusing taxpayer dollars. But I think a lot of people find that to be really easy, but there are some additional requirements with that, because it requires a blood relationship or a legal relationship through adoption or marriage. And then you have to have that court order. So it's not just like any old person who has a kid. So I think that's, and it's less money. So I think, and also, it doesn't include childcare. So I think that if you have a kinship person, like a next door neighbor or whatever, they're not going to be able to fall into that non-custodial category. And those folks are the folks that I think probably will see an increase over time, versus them just leaving custody. But one of the shifts I think we have to make with relatives is we look for, a CPS generally looks for the quickest way out, right? Like the quickest way that the kid does not have to be involved with us anymore. And sometimes that is not the best way to go, especially if a family needs support, right? If they need childcare, if they need financial assistance long-term, we have lots of ways that we can pursue that, and educating them is one of the things that we're really trying to work on, is educating them on what we can do long-term for relatives. Another thing that we've started that isn't being utilized very frequently, which surprises me, is we've subsidized permanent guardianship here, and we recently changed the requirements. I think it was like earlier, I think it was October of last year, we changed the requirements to not require pre-existing relationships. So if you have a significant relationship with anybody, and that you've been placed in their home for 6 months or more, then you can exit custody through subsidized permanent guardianship, and we will pay you an entire subsidy till they turn 18 or graduate, whichever comes second. So that's an option to get kids out faster. But I think the tendency is just to avoid custody altogether, which is great. I mean, like I want us to avoid custody if we can, and do that prevention work. And we're really working on that in Tennessee. But that's not always the best choice for a relative who's going to have to care for a child long term. And so I think we just have to kind of change our thought process on that.
Got it. Thank you for that explanation. I have a question in the chat, I think for New York. Can you talk about how you trained the kinship liaisons?
Sure. We developed a formalized training that's a full 2-day training. Right now it's via WebEx, right? So it's an online, but it's interactive with a instructor, and it kind of goes through all of I think it starts out with the philosophy, right? So why are we doing this? Why is this important? And your role as a kinship champion, you know, is integral to moving into a kinship system of care for the state. and then who the formalized resources are, learning about connecting with those as well as local resources. What's an important component, kind of an aside to that, is that in New York, we have both kinship support programs and we have what we call permanency resource centers. So we have statewide coverage for post-adoptive, post-guardian, and any kinship family that isn't a foster family. So throughout the state, you can walk into one of these centers and get services and get support, right? And it's a great thing. And we're hoping that piece, that if that family did a direct placement, right, and then they've moved on and they're not touching the system, but they need support and the caregiver's struggling, they can come through this center and find that support, that mechanism, or somebody can help them with some applications. And so that child and that family isn't disrupting and coming back into our system, right? So it's not just about the touch is over, it's their support to keep you moving in the direction that we hoped you were moving in. So with that, that's how the kinship caregivers or the kinship champions are trained. So they're trained by the state. And it's really to make sure that they understand from kind of a quasi-expert level about what the options are and how to navigate the resources that they have locally. Does that help?
Great. And we had a question in the chat. And Natalia, I saw you answer already, but I'd love for you to celebrate that number out loud for anybody that's listening. What are your current kinship rates, if you can share them? If you can't share them, no problem. But Natalia, since you put in the chat, maybe you could say yours out loud.
Well, not as good as Washington or Minnesota, because Washington says 75% and Minnesota said 63%. So I want to know how that happened. Because I will copy and paste. But in Connecticut on initial entry, number one, we lowered the number of kids entering care. So we have about 3,000 kids who come into care. We have on initial entry, it's about 51% of our kids or a little bit more. Their first placement, that first placement mindset, their first placement is with kin. And then overall of all of the kids, 0 through above, 44% is where we kind of average 45% of all of our kids are with a relative. If a child goes to a non-relative caretaker, a non-fictive kin, because Lindsay, you talked about blood relationship versus, the coach, that we have fictive kin built into our statute. So we have relative and fictive kin. If there's any familial relationship, you're a relative, right? That's how we see it. So if you go into a non-related caretaker, around 23% of those kids, their second placement is with kin. So, so they may start off their first, but then we keep going until we find a relative. Now, practice is not perfect, and again, I would love to be able to say 75%. The other difference with us is that our relative caretakers and our core, what we call foster care, everybody gets a foster care maintenance payment. So the moment that a child, you're entrusted with a child, whatever the foster care payment, maintenance payment is for that age group, and you receive it, relative or core. So.
Yeah. Lots of kudos to Connecticut for having that from day one. That has been awesome. Lindsay or Shelley, I'm happy to let you celebrate your numbers. I know sometimes people can't share them though, but
well, we have unreliable data. So it's our system is not designed to collect data by placement type. So it's pretty unreliable. I can say out of the homes that we approve, foster homes we approve, about 40% are kinship homes, one way or the other. And just to clarify, in custody, the ones that come into foster care, we've defined relative as anybody who has a significant relationship at all. The relative caregiver program that happens non-custodially is in statute, and it has the requirements for the blood, marriage, or adoption relationship, which makes it a little bit tricky. But we also, like Connecticut, pay the same board rate across the board. The only difference is if the relative has lived out of state and we require an Adam Walsh check, then we have to wait till we give them like a lower board rate until that's complete and then approved. I wish that wasn't the case, but for the most part, they get the same.
That Adam Walsh check is my pet peeve. If anyone out there, I will just keep hammering on it. We've got to fix that as a country. Shelley, I know you had some things to share from New York. Do you still want to do that, or do you feel like we covered it in the panel so far? Happy to defer to you.
I think we covered it so far. The only other item, thing, however you want to call it, that I wanted to share a little bit was just that because we're so different in the fact that local districts can implement, you know, the bumpers are bigger, right? Because it's not state supervised, state administered. I just wanted to maybe share some examples of different things that folks have done, you know, that we've kind of gleaned, you know, in preparation for today. So, for example, there are counties who they establish the use of templates, right, for their firewall. And I'm going to look at my notes, so excuse me. You know, templates where there's a family resource form that the kin specialist does. So an actual team person who is out there looking for families, because some counties, like I said before, you know, have the ability, the resources to have that team. So they have a family resource form that they update every 6 months. So that's their job, is to make sure that they're checking in and you know, somebody might think of something, you know, down the line. And then there is the same county has a consultation form that they have to fill out that goes to the firewall committee. So in preparation for all that, they've got to fill that form out and be ready. That's one of the really important things, right? Be ready when you go to the firewall committee that you know your case and you've got everything prepared. And then the placement into foster care. If a child ends up being removed and going into a non-family foster care setting, they have what they call a relative removal letter. So it goes to everybody that was on that list, and here's, hey, so-and-so is being removed from care, or, you know, being removed or being placed in foster care. Your name was given to us. You know, what are the ways that you can support this child? Because it isn't just about, is there a place for this child to live, but can you support that child in another way? Can you be respite? Can you help support the family, right? So let's use kin in every avenue that we possibly can to surround that family with different levels of need, right? So, and then there's a resource assessment form. So if people raise their hand, now there's another template that they use, right? And not to be so administrative with all these forms, but there's avenues, right? So everything is documented, and I think that helps for that caseworker turnover, because if my file shows you all of the steps that we took and the folks that we talked to and who we thought was a good idea, and I move on, somebody else can pick that up and say, hey, wait a minute, right? That next lens, that new eye. Another, I think, really interesting triage team, right? So the firewall team was referred to, like as Trish said, as triage team. The amount of brain power that this one jurisdiction had on it. They included an IPWA specialist, they included their legal counsel, and they included a quality management person from the county, so that they were coming in with that not necessarily caseworker lens, right? And to provide additional perspective about how to, you know, assess the case ahead of them. And then a couple of other examples, just looking to see if anything was necessarily different. Oh, we have one county that they start the kinship firewall at preventive services, not even considering removal. They start to look and talk to the family about other support systems, kind of like, so if you're feeling stressed, is there somebody who can come over so you can take a break, right? Starting that ahead of time so that there's a support system to maybe prevent it from going further down the line. So I just kind of wanted to share some of those.
No, I appreciate that. And I think, I mean, this group especially I love templates. I love copying and pasting things. I think it was key to the new kin specific model standards too, was everybody doesn't have the capacity to make a new form. If you have one that's working, like, let's share it. So I love that. Okay. Wow, this was an awesome discussion. I learned a lot today. Maybe I'll go around one last time, and just if you have any advice or final things you'd like to share on the topic that I didn't ask you about, would be great. I'll go in our typical order, I guess. So, Natalia.
I think the biggest piece for kinship firewall is you need to have your leadership on the table, and the expectation has to be set all the way from the top and all the way down. And the other biggest piece for me, QPI state relationships, and to be transparent with families. It takes time, but it's good work and it's the right work. And then, that's about it.
Yeah, perfect. Lindsay?
I think the thing that I would mention is just clear, consistent messaging, with high turnover in states and caseworkers. I think that there's a lot of knowledge lost, knowledge transfer lost. And so I think in Tennessee, I think that's some of the challenge is continuing to have the same message about the importance of kin, and doing all that work, and then what we consider to be effective diligent search is important to make sure that we just keep talking about, to make sure that everybody's on the same page. So I think that would be the advice that I would have.
Thank you. And Shelley and or Trish?
I've talked a lot, so I want to see if Trish has any input that she
Sure,
wants to
Shelley.
provide.
Yeah, thank you. I guess, from my lens, I would say involve the family. I think that's the most important thing. Involve the family in decision making, let their voice be heard, let them be part of the solution. Goes back to what Natalia was saying as far as relationship building. We have to form that trust with families and helping them, if they can't be the ones to care for their kids, like helping them find their people and their resources, and talk to the kids. Because sometimes parents might not be willing to share that information, or maybe not willing is not the right thing to say, maybe not able, maybe too scared, right? And rightfully so. We're the government coming into their lives. So I get that. But, the kids, they know who their people are. They know who they feel safe with. They know who they would want to take care of them if mom or dad cannot. And keep at it, right? Like that's important. Like even if families aren't able to share right away, don't give up. Continue to work on building that trust and that relationship, and keep circling back to who are your people? How can we help find the right people? So.
Yeah. Thank you so much. Natalia, I saw you put your hand up. Do you? Yep.
Yeah. I wanted to echo something that Shelley said, which was a game changer for us. And again, we're not where we want to be. With our previous commissioner, she connected our Child Welfare Bureau with our foster care division, and we became one entity, and it embedded the work of kinship into the child welfare work, investigation work, the ongoing services work, where before it was separate. Now it's embedded in part of policy. And I think that is a key point. And to remember also family dynamics of our kin who actually are entrusted with the caretaker, understanding that their pace may not be the pace that we're at, and they're dealing with a lot, and what supports are available for them to navigate those waters. So that's it.
No, thank you. I appreciate all of you so much. Thank you for being so warm and transparent and sharing with everyone. If you are hearing this and you are like, man, I would like to have a firewall policy. And I would note Broward County, Florida, as an example. I would say they have a step before a firewall policy where it's not required to get the approval for a non-kin placement. But what is required when you make a non-kin placement is that you write up a summary of the efforts that you made and then email it to your supervisor. So if maybe you're hearing like, I don't know, a firewall policy feels like a step too far for my agency where we're at now, maybe that's something to think about as a step in that direction. The toolkit has links to the templates that were mentioned today. But if you need help or you're like, hey, I would love to have a template or a policy, that's what this group exists for. You could submit a technical assistance request. We'll make sure that the link is in the chat for how to do that. And we are very, very, very happy to help. There's lots of SMEs like Heidi, who's been amazing to help you as well. Melissa, anything that you want to say? I'll pass it back to you. And again, thanks everybody. Thanks to our panelists and thanks to everybody for coming.
Thank you very much. Yeah, I just want to let everyone know our next session is going to be on September 12th at the same time. And Marina, if I'm correct, it's about encouraging foster families to keep connected with the child's kin.
Yes.
And
yep.
Yep. And so we would love if you come and be willing to share some of your ideas as well in that session too. So think about that. And we will have some people presenting and sharing their best practices, but we would love to also hear from you on how you're doing that in your own programs. And also, I want to let everyone know I put in the chat a link to our webpage that has all of the past the last learning community recordings, and if there's any related material that was shared. So please bookmark that and go back and tap into that as needed. And that is all. Thank you so much for joining us today. Have a great afternoon and a great holiday weekend.
Thank you.
Thank you all. This was great. Have a good day.
Thank you.